us Dr. Biju George, Professor and Head of Department of Hematology at the Christian Medical College at Vellore. Big round of applause as he takes the podium.
Thank you very much, and a warm welcome to all. Good evening. Diseases involving the blood or the blood cells are very common in India. And there are majorly three types. One which involves the cells, which is probably commonly called as blood cancer. A disease that can involve the bone marrow, which actually produces these cells, where there's a failure of the bone marrow to produce enough good cells, commonly called as aplastic anemia, and genetic diseases, which are very common in India, where the bone marrow produces the blood cells, but they get destroyed. This is a disease called as thalassemia. And as mentioned by Rahul Dravid in the video, every 5 minutes, somewhere in India, someone is diagnosed to have either aplastic anemia or a blood cancer or thalassemia. So the burden of hematological diseases is very big within the country. Now, there are some diseases where medicines are available, but there are some where medicines are not available. For example, thalassemia, there are no curative medicines that are available, and so it's a lifelong process of receiving blood transfusions. In diseases like aplastic anemia and leukemia, where medicines are available, they are quite costly. It's a prolonged process, and there's a lot of pain that both the patient and the family have to go through because the treatment goes on for months to years. But we need to remember that everybody who has this treatment does not get cured. So in all these situations, a lot of people would need a stem cell transplant for curing their illness. Now, to do a stem cell transplant, you need a donor. And how do you identify a donor? Generally, we have what is called as HLA or the HLA genes, which help in deciding whether the donor is perfect. Now, you get half of your genes from the father and half from your mother. So it is a chance that the best chance of finding a donor is within the family among siblings, that is among brothers and sisters. And how do you test for it? It is a very simple test which involves just taking the buccals, scraping or just a swab from the cheek, and from those cells DNA is taken and then the HLA testing is done. Unfortunately, because the HLA comes half from the father and half from the mother, only about 30% of patients who need a transplant actually find a donor within the family. So what do we do for the rest of the 70% who need a transplant but do not have a donor? That is where registries like the DKMS play a very important role in saving the lives of many patients. They enroll donors into the registry who are potential to donate, and then as a transplant center, we actually send in the HLA report of the patient to them. They actually look within the database and tell us, is there a donor, potential donor available? And if we do find a fully matched donor, then we can use that donor for the transplant. Once we know there is a donor, between the registry, the donor, and the patient, the dates are sorts of fixed, and then the transplant process occurs along with donation. Now, we need to remember that the donor may be far away, it may be in a different country, but that actually does not matter. The donor actually donates in a hospital which is very close to the hometown and doesn't have to travel all the way to the transplant center to give his stem cells. The cells are collected locally, and then it's usually taken by somebody as a hand baggage through the airlines and then brought to the transplant center for donation. One of the unfortunate facts is that the number of Indians who are available in many of the registries which are available abroad are less. And importantly, some of them donate, some of them do not donate. So for an Indian patient to actually find a donor becomes much more difficult. There are about 22,000 combinations of HLA that are available. So unless we have a pool of donors that are ethnically similar to the patients, it becomes difficult to find a donor. And that is why having registries within India and having a large donor pool within India will actually help in trying to find donors for all the Indian patients that need to undergo a stem cell transplant. Now, there are lots of myths with stem cell donation. There are a lot of misconceptions, not just in the general population, but even in the medical community. So these include, I will lose all my energy, I may get cancer in the future, I will not be able to work, it will affect my future, it could affect my children later down the life. Now these are all myths that actually does not happen. The process of donation is very simple. Once you're identified as a donor, you will go through a routine checkup, which is similar to what happens if you're going for a blood donation. You have a lot of tests that are done in order to find out whether you're fit enough to donate. Once you're fit enough to donate, you get injections which are similar to insulin injections. So it's just a pinprick morning and evening for about 4 days, and then you're connected to a machine which actually helps in collecting the stem cells. There was a time in the past where we used to collect these stem cells from the bone marrow, which obviously was more painful. You had to do it under general anesthesia, but now this is all through from the blood itself, and so this can be done even as an outpatient procedure. You just have the pain of a cannula sticking into your vein, which draws the blood out into a machine, which actually spins the blood around. That makes it separate into multiple layers, and then using a protocol where you want only your stem cells, you can actually collect it. You end up actually processing about 10 to 15 liters of the donor's blood. But what you finally separate out is about 200 to 250 ml, because the rest of the blood actually gets returned back to the patient, out to the donor's body. There's only like I mentioned, there is only the pain of a pinprick when you're actually inserting the cannula. The donor actually gets back to work the very next day, and most of the time has absolutely no problems. At our center, we have done more than 2,000 peripheral stem cell donations for sibling donors, right from children to adults, because we also do pediatric transplants, and we have had absolutely no problems with donation. So there are these myths, but I would like to use this opportunity to clear and tell everybody that it's a very simple process that can be done. So, since it's a very simple process, we encourage people to become donors, because you need to remember that you may or may not during your entire lifetime actually be called to donate, but if you do, you become a lifesaver. I would like to stop by just saying that even I am registered as a stem cell donor. I don't know whether I'll get an opportunity to donate, but if I do get, I would definitely donate. Thank you.